Hello, everyone, and welcome today. Tajahao, olá, todo mundo. Today, I'm excited to introduce Sawiza Evolution, an innovative healthcare solution developed by Tech to tackle critical healthcare challenges, especially in underserved communities. My name is Juvenal, and I'm the co-founder of Tech by Tech and graduated student from Beijing Liguntashe. We are named among the top startups by Top Road, and we are the winners of Angola National FinTech competition organized by EMIS, the biggest Angolan bank service provider. But I would like to focus on addressing some healthcare challenges in China and Portuguese speaking countries, where disease like malaria, mental health issues, and cardiovascular disease are the main causes of death in this zone, while also contributing to 5% of global carbon emissions. Talking about the so-called silent epidemic, we're talking about that 40% of all deaths in China is related to cardiovascular disease, while in Portugal, one of the highest stroke mortality where has like the one of the highest rate of stroke mortality in Western Europe, according to sources like World Health Organization. There is also another crisis like challenge this particular area of countries. It's affecting people in Hong Kong. It said like that seven in where like 1 in 7 people in Hong Kong suffer from common disorders, and approximately like 35% of young people in Macau are at risk of depression and anxiety disorders. So combining this, there is also the last, let's say, the biggest challenge in this region, and we're talking about malaria with like 9 million lives affected just in Mozambique, and responsible for majority of deaths in Angola, especially in remote areas where healthcare is still limited. So we present Sawiza Evolution, combines teleanalysis like facial recognition and AI personalized medicine, big data analysis, and renewable energy to integrate into a deliver comprehensive, sustainable healthcare solution. This allows for early diagnosis and personalized medicine powered by 100% renewable energy. And we, of course, apply strictly with the security and data privacy of the users, where we plan also to integrate later on the AI enhanced diagnostic for malaria. So basically, what the Sawiza evolution does is through facial recognition, we detect early signs of cardiovascular diseases and mental order diseases by analyzing facial cues and speech pattern. Our next step, as I said, is to make the diagnostic for malaria as well. And besides this, we also work on fully renewable energy while generating carbon credit. The system currently we plan to detect symptoms from disease like stroke, depression, skin cancer, and anxiety. Regarding to the opportunity, the global telehealth market is projected to reach 459.8 billions by the year of 2030, driven especially by the growing demand for remote healthcare solutions. In terms of business model, we plan to offer subscriptions models for communities and healthcare organizations. In addition, we will generate carbon credits by utilizing 100% renewable energy, providing another revenue stream. In terms of competitive advantage, besides the facial analysis, which is something new, we have the first mover advantage by combining AI diagnostics, augmented reality, and renewable energy into a single sustainable healthcare solution. And I believe that this put us in a unique position to compete with companies like Teladoc Health, but with a greater focus on sustainability and social impact for Sawiza evolution. Although we Even though we are in the early stage of Sawiza, but the system has already been used in Angola as a software management for system. This allows us to establish relationship with healthcare providers, to conduct kind of test pilots of Sawiza in Angola. And going forward, we also plan to collaborate with China and Portuguese speaking countries to localize the technology for each region. This includes things like working with Tsinghua University for AI localization, and maybe a university in Brazil for Portuguese AI models, not just for the language, but even for the cultural context and, let's say, the race context as well. We plan to collaborate with them. And we project for Sawiza the first year revenue of 361,000, growing to 1,377,000,000 by the year three. And currently, we are seeking of an investment of 808,500 to fund our technology development, renewable energy infrastructure, and operation. In year one, we will refine our platform based on feedback from pilot tests, expanding to more communities, and growing to expand to countries like India and Latin America. Key risks include infrastructure maintenance, especially in remote areas, and financial delays. We plan to mitigate this risk by forming strong local partnership and training, as well as building a reliable renewable energy infrastructure. Our prototype is operational in Angola as we are progressing well. So we invite you to join us and drive global healthcare innovation, making a lasting impact global in communities, especially on unserved communities. 谢谢。